So if we were to look into some different modalities, so CBT, a type of psychotherapy, and it really looks at the relationship between your thoughts, feelings, and behaviors. They're shown lots of benefits in the menopause and perimenopausal period. In particular, it can help with the managing of the vasomotor symptoms that Dr. Tema and Dr. Lisa talked about before, so with hot flushes and night sweats. There's also evidence showing that CBT therapy, that psychotherapy, can help with anxiety and stress, and in particular, identifying and managing the negative thoughts that might be around going through this period of life. And as Dr. Temmer mentioned, it's just a natural progression of life. Sometimes when we have changes in our life, our natural response as human beings is to challenge them or to think negatively around those ways. So CBT can be a great way of just exploring and looking at your connection between those thoughts and behaviors. And the other great benefit of CBT can be improving your sleep. Another modality for some people is acupuncture. So acupuncture exists in the world of traditional Chinese medicine. It looks a lot about the mind and the body, as well as your environment. So they say with the role of the body is really to anchor the mind, and the mind invigorates the body. And these two things can't be separated. So your body is going through great changes. So naturally, this may interrupt the mind and the mood, things like that. So some of the points with acupuncture, so it looks at channel systems in the body. So one of them I can show you on your wrist first is, so if you got the inside of your wrist and the outside, so on the inside is the heart 6 acupressure point. And on the outside is the lung 9. So a simple method can just be using your thumb to massage along the wrist here. So the heart 6 can be great for night sweats, and the lateral side there. So in Chinese theory, the idea of menopause is when there's a slow decline in your yin and yang, also your essence and qi. Another point, sorry, I've not shaved my legs for today's talk, is on, I don't know if anyone can see here, is on the inside of the foot. So you have above the ankle bone here, which is the medial malleolus, if you use 4 fingers above and in the center, this is your spleen 6 point here. This is really good for strengthening and nourishing, and it's just a great point in women's health in general. Now, not relevant to the menopause area, but women of childbearing age or who are pregnant, this is actually contraindicated because it can induce labor. And the other part is the ankle bone just below it. You have here your kidney 6, and this is a great point for insomnia. So perhaps your loved one or a friend can give you a bit of a foot massage just before bed, things like this. Other areas that are great in complementary therapies is things like yoga and massage. So anecdotally, I've worked with lots of women who I think a combination of going through the menopause, the stress of their natural life, and just kind of finding the time to come in and to settle and to be. So things like yin yoga, which is a practice which is more relaxing, more spending time with yourself and going through some breathing exercise can be great. For those who have never had acupuncture before, I thought I'd show you some needles. I've got a helpful volunteer here, complimentary. So they're very tiny needles. There we go here. So they come in a little pack here. And for example, they're going inside. So I think if Tamara will use your arm. So we'll just go here. So if we use a point here, so I won't do a particular pressure point per se, but just to show the simplicity of how they work. So you have a little introducer just on the skin, and it's just straight in like this. So they're quite simple, very flimsy, and the pain's minimal. So there's also the idea of going to traditional Chinese medicine practitioner for individualized treatment, and they can look at what's going on in your life. Sometimes there's different herbs and things like this. But yeah, and to do with the cognitive-based therapy, there's different ways of providing this treatment. So it can be individualized with a therapist. There can be group sessions. There's also help books and online courses and things like this.